One of the things we hear about as a reason for major health care reform is the lack of access to care. And that's what I'm going to talk about. There we go. We all hear about the uninsured, and that's one of the big buzzwords in Washington these days, and how the uninsured do not have access to health care. I have a question. Do we see sick people dying in the streets of America? The answer is no. We really don't see that. Okay? That's because we have a health care safety net in this country. That health care safety net is the emergency room where I work. In the ER, we take care of everybody. By law, if you show up in the ER, you get treated. The law is called the Emergency Treatment and Active Labor Act. It was passed in 1986. And the government mandated every emergency department in the country to take care of all comers. Young, old, legal, illegal, it doesn't matter. If you show up at the hospital, you get the care. Now, everybody knows this. And, people call 911 and the ambulance brings you in. There's a problem with this, though, this open door policy. Number one, when the government made it, they mandated that we care for everybody, but they didn't attach any dollars to that, so we don't necessarily get paid. And that's one of the reasons your ER bills are so high, is because you're paying for all the people that don't. But with these people coming in and accessing the care, it's caused a crisis in the ER. Between 1996 and 2006, 200 emergency departments throughout the country closed. These were primarily inner-city hospitals who just couldn't afford to keep their ERs open. ED visits as a whole increased over 20%. When you give everybody access, they come. There's a third point on here, is that people are getting sicker. People coming to the emergency room. Partly because people are living longer, but partly because the government changed the Medicare rules for hospitals, and hospitals are now throwing patients out of the hospital sooner. And a certain number of those people aren't quite ready to come home, and they bounce back to the emergency room. So our acuity, they call it, the severity of illness, has really skyrocketed in the ER. It used to be 5 or 10% of patients in the ER got admitted. Now in some places it's as high as 20%. So we're working hard. What this has done is it's constipated the emergency departments all across the country. Okay? If you go into ER anywhere, you're going to wait. I see a lot of nods in the audience, so I know some of you have experienced this. And 1 out of 3 people in the country go to the ER every year, over 100 million ER visits. So the Government Accountability Office, the GAO, did a study just 2 months ago and showed that the most severe patients, what we call Category 1, that need to be seen within 1 minute, the average wait time for those patients was 28 minutes. Okay? You could literally die in the waiting room. In some places, we've got patients in the hallways waiting for a bed upstairs. In some towns, there's ambulances circling, trying to find a hospital to go to. It is a serious problem. We just don't have the beds to take care of everybody. There's other issues. It's sometimes hard to get specialists. Again, this is primarily a reimbursement issue. We have trouble getting specialists to care for people. People out in the community. If you sprain your ankle and you want to see an orthopedist, if you don't have insurance, it's hard to do. That's a real problem. There is good news in our healthcare system, though. We do have access to the best technology and the best pharmaceuticals, the best trained people in the world. Most of the drugs that come on the market these days are invented in the USA. Most of the new technologies is US-based. And this really is an advantage. And whatever we do with healthcare, we don't want to mess up what we already have that's good. Including the Medicare drug plan that got passed a couple of years ago. My mother-in-law just had lung cancer, and her doctors were concerned whether she'd be able to afford the medicines or not. She's a Medicare beneficiary. Everything was covered. You know, all you heard in the news about how this was going to be terrible and people would get their drugs, you don't hear that anymore. It works. So let's talk about the problem. Who suffers? You know, we do have access problems in this country. We handle people that are sick really well. The issue is when you're generally healthy. When you don't have insurance, you want to see a primary care doctor, family physician. You want to get preventative care. If you don't have insurance, it's tough to pay for many times. Now, there are two categories of people who do have access to the full spectrum of care, well care and sick care. And those people are the young people who, even if you don't have insurance, you're covered by Medicaid or the S-CHIP program, the State Children's Health Insurance Program by the government. And everybody's covered. So if you're young and you don't have insurance, it's yours or your parents' fault for not signing up. The coverage is there. Also, everybody over 65 has access to everything on the Medicare population. So the real issue is the people between 18 and 65 in their working years. And if you look at, I think this will work. No, did not work. So young people are covered, elderly are covered. It's these folks in the middle, the working people.